Are the medications you take daily silently increasing your risk of a heart attack? Many people rely on common medications for pain relief, birth control, mental health, and chronic conditions, unaware that some of these drugs may be putting their heart health at risk. In this crucial video, we will uncover 6 commonly used medications that have been linked to an increased risk of heart attack and other cardiovascular complications. Understanding these hidden dangers is essential for making informed decisions about your health and well-being. 1. Hormonal contraceptives. Hormonal contraceptives have been a revolutionary tool for family planning, but their impact on cardiovascular health is often overlooked. How do they increase heart attack risk? Combined hormonal contraceptives, CHCs, which contain both estrogen and progestin, can increase the risk of arterial thrombotic events, such as heart attack and stroke. Research involving over 2 million women found that those using estrogen-progestin combination pills had twice the risk of heart attacks and strokes compared to non-users. Vaginal rings were associated with an even higher risk, increasing the likelihood of heart attacks by 3.8 times. Why does this happen? Estrogen can enhance blood clotting by increasing the production of clotting factors, leading to a higher risk of thrombosis. Women who smoke, have high blood pressure, or high cholesterol face an even greater risk. Are progestin-only contraceptives safer? Progestin-only options, such as implants, injections, and intrauterine devices, IUDs, generally pose a lower cardiovascular risk. The progestin-only IUD showed no significant increase in heart attack or stroke risk, making it a safer alternative for those with heart concerns. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen and naproxen, are widely used for pain relief, fever reduction, and inflammation control. However, these medications can significantly increase the risk of heart attack and stroke. How do they increase heart attack risk? NSAIDs work by inhibiting COX-1 and COX-2 enzymes, which play a role in inflammation and blood clot regulation. This inhibition can disrupt blood vessel function, increasing the likelihood of blood clot formation. Key findings from research. The FDA has warned that heart attack and stroke risk can increase within the first few weeks of NSAID use. The risk grows with higher doses and prolonged use. Some NSAIDs, like diclofenac, have been found to significantly increase the risk of major cardiovascular events, while naproxen appears to be a safer option. How to use NSAIDs safely. Use the lowest effective dose for the shortest possible duration. Avoid NSAIDs if you have high blood pressure, heart disease, or a history of stroke. Consult your doctor about alternative pain management strategies. 3. Thiazolidinediones, certain diabetes medications. Medications like rosiglitazone, used to manage type 2 diabetes, have been linked to serious cardiovascular risks. How do they increase heart attack risk? Rosiglitazone improves insulin sensitivity, but also affects fluid retention and lipid balance, increasing the strain on the heart. A 2007 study published in the New England Journal of Medicine found that rosiglitazone increased heart attack risk by 43%. Other risks. Rosiglitazone is strongly associated with heart failure due to its effects on fluid retention. The FDA has placed restrictions on its use due to safety concerns. Safer alternatives. Many newer diabetes medications, such as SGLT2 inhibitors and GLP-1 receptor agonists, offer better heart protection while effectively managing blood sugar levels. 4. Certain antidepressants. Antidepressants play a crucial role in managing depression, anxiety, and other mood disorders, but some can have unintended effects on the cardiovascular system. Certain classes of antidepressants, particularly tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, have been associated with heart-related side effects that may increase the risk of heart attacks or other cardiovascular complications. How do they increase heart attack risk? Tricyclic antidepressants, TCAs, TCAs, such as amitriptyline and nortriptyline, work by increasing levels of serotonin and norepinephrine in the brain. However, their effects extend beyond mood regulation and can impact heart function in several ways. Lower blood pressure too quickly, leading to dizziness and an increased risk of falls, especially in older adults. Disrupt heart rhythm, potentially causing arrhythmias and palpitations, which can be dangerous for those with existing heart conditions. Cause tachycardia, rapid heart rate, due to their effects on the nervous system, placing extra strain on the heart. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, Prozac, and citalopram, Celexa, are generally considered safer for the heart than TCAs. However, they are not entirely risk-free. High doses of citalopram and escitalopram have been linked to QT interval prolongation, which can lead to a rare but serious heart arrhythmia known as torsades de pointes. While less common than with TCAs, SSRIs can sometimes cause minor fluctuations in blood pressure and heart rate, particularly in sensitive individuals. Safer options. SSRIs are generally preferred over TCAs for individuals with heart disease due to their more favorable cardiovascular profile. Patients taking antidepressants, especially those with pre-existing cardiovascular conditions, should be closely monitored for potential side effects, such as irregular heart rhythms, dizziness, or blood pressure changes. Doctors may recommend alternative treatments, including lower-risk antidepressants or non-medication-based therapies, depending on the patient's medical history. 5. Pseudoephedrine, common decongestant. Pseudoephedrine, a common ingredient in over-the-counter cold and allergy medications, is widely used to relieve nasal congestion and sinus pressure. While effective, it acts as a stimulant, which can have serious cardiovascular effects, especially in individuals with pre-existing heart conditions. How does it increase heart attack risk? Pseudoephedrine works by narrowing blood vessels to reduce swelling in the nasal passages. However, this vasoconstriction is not limited to the sinuses and can impact the entire cardiovascular system. It may raise blood pressure, increasing strain on the heart, increase heart rate, leading to palpitations, trigger arrhythmias, especially in those with underlying heart conditions such as atrial fibrillation or coronary artery disease. Research findings. Several studies have linked pseudoephedrine to acute coronary events, particularly in individuals with hypertension or pre-existing cardiovascular disease. In some cases, excessive or prolonged use has been associated with increased risk of stroke due to heightened blood pressure. The risk may be further amplified when combined with other stimulant medications or caffeine. Precautions. Individuals with high blood pressure, arrhythmias, or heart disease should consult their doctor before taking medications containing pseudoephedrine. It is advisable to monitor blood pressure and heart rate when using this medication, particularly for extended periods or in higher doses. Alternative decongestants, such as saline sprays, steam inhalation, or antihistamines, may be safer options for those at risk. While pseudoephedrine provides effective short-term relief for nasal congestion, its potential impact on heart health should not be ignored. The medications we take every day can significantly impact heart health, sometimes in ways we do not immediately realize. Understanding these risks is essential for making informed decisions about your treatment options. What you can do: talk to your doctor before starting or stopping any medication. Monitor your heart health, especially if you take high-risk medications. Explore safer alternatives when possible. If you found this video helpful, please hit the like button and subscribe to stay informed about the latest health insights. Let us know in the comments if you have any questions or if there is a health topic you would like us to cover next.